Hello everyone, and thank you for coming out today. My name is Nicole Kennon, and I'm here to discuss with you the importance of naturopathic doctors and how they can positively impact our state and our healthcare systems. While naturopaths are currently allowed to practice as primary care physicians in other states, Florida is a state that remains hesitant on this decision. I'm here to explain to you why we should enact a policy to legally let them practice as primary care physicians in the state of Florida and how they will have a positive impact on the public health community. Not only have many states across the country already passed a policy to let naturopaths get licensed, but the surprising demand for primary care physicians in the future of our country is rising. With more people needing quality health care, the bigger demand it puts on physicians to meet those demands. If there is not enough primary care physicians to fulfill this need, then our communities are at chance of suffering. Enacting a policy to let naturopaths practice as primary care physicians in the state of Florida won't only contribute to the number of practicing physicians meeting the demand that is needed, but it will also contribute to better healthcare in the community by providing enough physicians to meet demands. It will provide a more diverse healthcare system with various healthcare options for consumers, and it will also lower healthcare costs in our state by providing prevention measures, which results in less treatment costs. With population growth possibly being our largest factor, the need for primary care physicians in our country is rising and will continue to rise over the course of the next few years. The total number of visits to primary care practices is expected to increase by over 103 million by 2025. With an already shortage of primary care physicians in the country, we can expect the need of these healthcare providers to be in heavy demand in the coming years, unless something is done. In order to protect the public health community, the only feasible thing to do would be to let other qualified physicians take on this role and provide care for our state's healthcare needs. While Florida has yet to give the go on letting naturopathic doctors practice as primary care physicians, there are currently 21 other states in the United States that do allow the licensure and registration of naturopaths, which allows them to practice as primary care physicians. With that many states in this country now regulating this practice, I think it only seems necessary that Florida should be next. The healthcare community is doing what is best for public health, and I believe the next step to ensure health and wellness in our communities is to pass this policy so the needs of the public will continue to be met. 21 states are already allowing the practice of naturopaths. I believe it's safe to say that a trend is occurring within the naturopathic community and their rise in the public health community. There is a reason why so many states are hopping on board and enacting a policy to let them practice. I think we all need to take this policy into serious consideration. If the demand is not met for the rising need of primary care physicians in our state, then the public health community could negatively be affected and having limited access to primary care physicians with not enough licensed physicians practicing. People in the community could then be majorly impacted by not receiving the proper care they might need or want. Allowing naturopaths to get licensed as primary care physicians could contribute to better access to healthcare for the community and contribute to the supply of the issue. If this policy gets passed, the entire state of Florida and its communities will be positively affected by providing better patient health care in the local areas. If this policy is enacted, it will provide more primary care physicians in the state of Florida, thus closing the shortage gap of healthcare professionals. By doing so, the public health community is getting more service to their needs and healthcare issues met. Now, there are some things to consider that might change if this policy does go into effect. Considering naturopaths practice medicine a little different than those of conventional medicine, the care some will be given might differ. However, that doesn't mean that the care will be of any lesser quality. Naturopathic doctors see the body as a whole, with all its parts relating to one another. They recognize that the body is a powerful tool which has natural healing properties. They believe balance is a very important aspect of health and practice various techniques to restore that balance. With that being said, they focus on finding the root underlying cause rather than treating symptoms as they come. This differs slightly from conventional primary care physicians that are currently licensed to practice in our state. Our primary care physicians treat symptoms as they come and don't necessarily see the body as interconnecting parts like naturopaths do. While these two types of doctors do see health within the body differently, it does not mean that one is superior over the other. With naturopaths licensed as primary care physicians in Florida, the care that those of the community receive might change in this way. With more primary care physicians practicing in the state of Florida, the cost of healthcare treatments may reduce. Now, my reasoning for this is because naturopaths' main focus is to heal the entire body by finding the root cause. They try to heal alignments altogether so symptoms do not reappear. This is why they focus on getting to the underlying cause and figuring out what is causing the alignments, and then they put a stop to it so any further illnesses do not occur. Naturopathic doctors view disease as a disturbance in the body with various factors that contribute to these disturbances. These can include poor nutrition, stress, or toxic exposure. When promoting the elimination of such things, the prevention of various diseases can occur, thus reducing healthcare costs by preventing diseases from happening in the first place. With the increasing number of people opting to use naturopaths for their healthcare needs, along with the growing number of insurance coverage for this particular type of medicine, the risk of not enacting this policy could be substantial for the state of Florida. Aside from not enough primary care physicians being licensed to meet the demand they are in, there is the problem that if people who want a naturopathic primary care physician cannot get their healthcare needs met in the state, what's to say they won't move to another who already has legalized naturopathic doctors to practice as primary care physicians? I believe enacting this policy will change the lives of people in this community for the better. No two people are alike. So why not provide primary care physicians who can cater to the individual's needs and wants in the healthcare setting, especially when the need for these people is so high? More people will get the healthcare service they need for treatments, as well as learn of various prevention factors to reduce the chance of further illnesses from occurring. Thank you for listening, and please take what I said into consideration.